There is no typical drug and alcohol use pattern applicable to young people, and not all drug or alcohol use is problematic or requires specialist attention. Most young people experiment with alcohol and other drugs at some stage, and even though experimentation can create risks for adolescents, most go on to develop a pattern of use that is relatively harmless. Experimental use describes a young person's early use of drugs or alcohol, and a young person's exploration of the effects of each. Recreational use describes AOD use for the purpose of enhancing leisure. This pattern often occurs socially. An example is the twice-monthly use of ecstasy by a young person when clubbing or partying. Situational use describes AOD use which is specific to a situation or context. For example, a young person may use cannabis heavily, but only when visiting their father on weekends. Or a young person may use amphetamines exclusively prior to school exams. Intensive use is associated with heavier, more frequent, and/or more harmful or risky use. Use is considered intensive when it occurs in a range of circumstances and settings. Dependent use describes the pattern when a young person finds it difficult to control or stop their use, uses more than they intend, or where use continues despite negative consequences. A young person with a dependent use pattern may also experience withdrawal symptoms when not using. It's important to note that young people may have different patterns of use for different drugs at the same time. Young people don't necessarily move through these patterns sequentially. Recreational use doesn't necessarily lead to situational, intensive, or dependent use. Young people's patterns of use can move both ways. For example, dependent use can become situational use. And regular substance use doesn't always lead to serious problems.